Hello, I'm Kevin Cameron, Marion County Commissioner, and we're here today for Marion County Today's program on our Marion County Behavioral Health Program. I'm here with Carrie Moeller, who is our Health Department Administrator. Carrie, welcome to the program. Great, and this is a really knowledgeable area for you because before you became our Health Department Administrator, you actually headed up this department as Division Director. So
that's right.
You've got a really good background on this. It's great to have you with us today, and thank you for all the service that you provide the citizens of Marion County. Why don't you give us a little background on yourself and how long you've been with Marion County and some of the roles that you've played?
Happy to. So I've been with Marion County for 17 years of my career. Recently, though, just 9 years after being in Lynn County for a while. I've worked in community mental health programs for almost 30 years, which is kind of surprising. Recently, as you said, just 5 months now as the Health Department Administrator. So my service to Marion County has touched all of our behavioral health programs, which we'll talk a little bit more about today. I have a master's degree and I'm a licensed therapist as well.
Fantastic. Why don't you give us a little, because we are talking about behavioral health today, but why don't you give us a little bit of an overview of the Marion County Health Department,
Sure.
Some of the things that we do.
I think the citizens of Marion County will be surprised about how comprehensive, how many services we provide at the Health Department. I think the role of the Health Department, though, is to facilitate a conversation, to talk with people about what it means to have a mental health condition, a substance use condition, to need public health services. I think our job is to break down biases and stigma related to those things, developmental disabilities. People come to our services with lots of capabilities, but they also have some needs. So let me talk about the sort of overarching services that the Health Department provides, and then we can talk a little more specifically about behavioral health.
Yeah.
So public health. Public health is about prevention, and public health is also about some services to individuals in the community. Prevention, helping people not start smoking, so tobacco prevention, chronic disease prevention, wellness activities, gambling prevention, suicide prevention. So those are kind of behind the scenes, but it's the great work that we do to help people not get to a place where they have a condition that we have to eventually treat. Mm-hmm. So other sort of well-known programs in the public health arena, WIC, immunization, so kids who need to go to who are entering school need to have immunization in order to get to school, so we provide a big immunization clinic regularly. And then probably the more familiar things like restaurant inspections, water quality inspections, things like that. That's generally public health. Behavioral health is organized in 4 general areas. We've got services for individuals who have intellectual and developmental disabilities. We provide case management and supports to people in their homes or in the community. We have behavioral health. Behavioral health is also broken up into addictions treatment and mental health treatment. So we provide counseling services, crisis intervention services through our psychiatric crisis center. We provide community support. So our hope is that people can live independently and successfully in the community. So we want to not just expect people to come to the office, but we go to them where they need the supports. And then we have administrative services. So we manage our complaints program through there. We ensure that we have private protected health information, so we manage that through our administrative services and contracts and things of that nature. And then we also provide what I would call intensive outreach or wraparound services. So people who have need extra support, and we do that through oftentimes a relationship with people who had already been in services, so we call those peer supports. We've learned a lot over the last 50 years from people who are in recovery, and that people can and do recover from mental health conditions. But when we listen to people who've had that experience and pair them with people who are just learning about their mental health or addiction services, it's very powerful. So people can coach and help and support people through their shared experiences.
I didn't even have to ask you to explain what those things were. You just went right into it. You just have so much knowledge, and we just so appreciate that. Why don't you tell us a little bit about how people can get involved with the health department,
Sure.
or even just generally in their community through the health department?
Yeah, so we have 4 standing committees of the health department that we really are open to and encouraging people to help. So we have our health advisory board, and that's a statutorily regulated committee where people can help give us guidance and direction on the overarching services that we provide in the health department. We also have our local alcohol and drug planning committee, which is a subcommittee of the health advisory board, as well as our Intellectual and Developmental Disabilities Committee. That's a mouthful. But those are specific focused areas that can help guide and direct the overarching work of the health department. So we have applications through our volunteer services coordinator. If people are interested, we'd love to have them.
Yeah, and I'm not sure if later on in the program somebody's going to talk more about the crisis center. I just think that that's an asset that a lot of people in Marion County don't even realize. It's over by Salem Health, by the hospital, and the services are provided in our community are extremely important.
Yeah.
One of the things I got to experience that I know the health department is involved with, that from even a public safety behavioral health issue, is our court teams. That the health department has helped with our sheriff's department and the Salem Police Department, and now Woodburn, I believe, has one. And why don't you tell us a little bit about how that has evolved and the partnership there?
Sure.
And how that works?
So besides our local law enforcement agencies, we also have, and I'll talk a little bit more about that, but I think it's important to recognize how important collaborations are with the work that we do in the community. So besides our local law enforcement agencies, we partner with schools and primary care clinics and our juvenile department. People have other needs and touch the community in many different ways. So having an important collaboration with those departments really helps us to provide the best services possible to the individuals in our service. So the Psychiatric Crisis Center, 24-hour, 7-day-a-week crisis service. It's really designed to help people get the services and supports they need. So in collaboration with the District Attorney's Office and the Sheriff's Office, we've created these teams that pair qualified mental health professionals with law enforcement officers and go out and contact people to help get them the services that they need. It's a state-of-the-art, and Marion County is highly regarded for the work that we're doing there.
I know we hear a lot about it over in the Capitol. I actually got to witness that one time doing a ride-along with the Marion County Sheriff. We got a call on a domestic violence, potential suicide up in Aurora, and we were down on State Street, and we ended up it was fun. We got to go about 100 miles an hour up the freeway. Kind of scary at that point. But after we were there, and the sheriff deputy had some training, so he was able to diffuse the situation. But within about a half hour, up drives a Salem police car with one of the court mental health specialists in there, all the way up into Aurora. So that's a good example of the collaboration that's going on between county agencies, city agencies, and the like. So. I just think that it's a great testament to not only the health department, but all departments in Marion County and how people work together. So, anything else you want to share with us about I was curious. I know we have like 1,600 employees in Marion County.
Yeah.
Do you know how many employees are close to how many employees are actually in the health department?
450.
450.
Approximately. Marion County Health Department is the largest department in the county. I think there are a couple other programs I think we'll highlight, and we'll hear some more today about those. We've got an early intervention program to help people not develop high-impact mental health issues. I said something about our peer support program. I can't say enough about the power of peers. We also have drug and alcohol treatment services for people who are struggling to get off of pain meds and illicit drugs. Our services are very comprehensive and very exciting. I'm very proud of the services we provide.
And you mentioned that about having mentors and people who really can help you, and I appreciate that in my life, just in a lot of things that I do. So thank you very much, Carrie, for your service and for being here with us today.
Thank you.
Appreciate it.
I'm Marion County Commissioner Sam Brentano. We're going to continue our program on behavioral health, especially Marion County behavioral health programs. I have a couple people I kind of know, but we'll really get to meet here a little bit. We'll start right out. I think I'm going to go to you first, Sydney.
Okay.
Now, in prior interview, we heard that I had it wrong, assistant director. Tell us what you do, and you've just taken over a role.
I have, yes, thanks for asking. So I'm Sydney, and just started in a new role as of June for Behavioral Health Division Director. I've been with Marion County about 11 years, and so prior to this position, I supervised our intensive children's and adult mental health services for, about 11 years.
So what I was trying to get at, from this position, you go right to health director. Are you ready for that?
Boy, I hope so. It's
Okay.
too late if the answer's no now. Yes.
And do that again. So what the prior job you were really doing what other than the title?
I was supervising intensive programs for children, youth, and adults. So the programs that are more intensive than outpatient. So.
Okay. Here in Marion County.
Mm-hmm. Yep.
And then Elizabeth Perkins, she's not the movie star, I found out, but could be. We don't know. There's a lot of time.
Possibly.
With Youth Move Oregon. So Elizabeth, tell us about what you do now. Let's start now. What did you do prior? How did you get here? And then I don't know what this Youth Move Oregon program is. I guess that's part of what we're going to find out today. But if you would, Elizabeth, go ahead.
Yeah. Well, this is my first role as a peer. Before this, I worked in the mental health field. In the residential setting, so it's a lot different. And what I do now with Youth Move is work with Marion County's Young Adult Rental Assistance Program, helping young people find housing. And as a peer, that's a big role, and it's a lot different from what I'm used to. And
so you're saying young people, there's an age group that you concentrate on?
Yeah, so transition age youth for our program, 17 to 25.
So you're getting them out of their homes where maybe some of them or most of them have lived till now? Or?
Actually, some of them are coming from their homes, but a lot of them have come from either foster homes or have experienced homelessness. A lot of them are coming from other systems, so a different level of care sometimes. It just depends on the situation, really.
So does something happen at 17, some funds or program change that doesn't support them anymore, or is it just time to get out on their own? What are you trying to accomplish?
I think that is the age that that a lot of the young people are given up on, really, in other areas, or at least that's my experience. And so this program is helping them to move forward in a way that maybe other programs couldn't help,
I'm making this up, but it's probably hard about right then. They're not really a child anymore, and you can't deal with them that way.
Yeah.
They're not really an adult or heading that way. It makes it harder.
Right.
And Sydney, how then are you involved in this?
So we've had a really successful rental assistance program for about 4 years, and then the opportunity came to apply to add to our rental assistance program and focus on young adults. So we wrote the grant application, and we're one of 2 programs selected in Oregon to serve this specific population, which has, as Elizabeth was saying, some really unique needs because of their age. I think it's a normal developmental point to start to move away from adults and to want to live more independently, but the young adults that we're serving are faced with challenging barriers that probably most of us were not faced with: lack of a support system, law enforcement involvement, mental health symptoms that they're dealing with, poor education responsiveness. And so I just get to really oversee the staff in this really great program and support the work that they do, which takes a lot of creativity and a lot of ingenuity in order to do.
So it's a rental assistance program, and real quickly, that part of the rent, all the rent, find people that can take them and help them. What?
So the program has 2 staff in it, Elizabeth, and then we have a case manager also assigned to the program, serves 15 young adults. And so we provide rental assistance. We have a budget. We can pay up to $627 a month towards someone's rent and utilities. The young adults are expected to contribute 30% of their income, if they have any, towards their rental costs. But I think the more important thing that we provide is the services and the supports to really help the young adults develop skills that allow them to live independently successfully. I don't know about you, but when I left my family home, I had opportunities to move in with roommates. I lived in a dorm in college, and these are not the kinds of opportunities that most of these young adults have. And so the work that Elizabeth and Sue do is really instrumental in helping them build connections and skills.
I'm wanting to know too many things.
It's all right.
So I know that more than rental, they need some type of supervision. They need food and clothes, everything else. How does that
They sure
happen?
do.
Other programs, you coordinate those?
So yeah, a big part of the case management and then also my role is to help them access other community resources, to find ways to live independently through other programs like SNAP, and a lot of our individuals are receiving Social Security for their needs, and so through those services, we're helping them meet those other needs that they have.
So how do people find you or the program? How are they referred to you?
So a referral can happen through word of mouth. That's happened where a young person heard it from another young person and they referred themselves. Otherwise, we get a lot of our referrals from other community agencies like ISA, and
Parents
can
Can this
make those
program be
referrals.
set up if you wanted to stay at home and help? You have to move from home to be part of this program?
Yeah, that's the goal, is
is.
to promote
I just
self-efficacy.
thought of some way
and-
to support them somewhat.
Yeah.
And if you had some property or interest, how would property owners connect with you or find out?
We would love to talk to them about this. I mean, the housing market in Salem is really challenging, and most of the young adults that we work with have little to no rental history, maybe no income, maybe even a criminal record. And so as property managers are looking at a variety of applications for limited apartments, the young adults we serve are not typically at the top of the list. And so Sue and Elizabeth do a lot of work with property managers to help them feel more comfortable renting to our young adults. And so a large part of what Elizabeth does is really building those relationships with property managers. So if anyone has an apartment and is interested, really fills this mission to help young adults in need, we would love to hear from them.
So has to be in Salem, anywhere in Marion County?
Anywhere in Marion County.
And how many people are you serving?
We have 15 slots open, and we have 15 slots
You have
filled.
15 people out now.
Yes.
Real quickly, got like a minute left. Got a good story, something that makes you go
Yeah,
wonderful.
there are a couple young people that stick out to me. They live together, and two of them are in our program, and we're strengths-based, which means that that we focus on an individual's strengths, and that's how we help them meet all of their needs. And these individuals have really excelled by getting housed. Like, housing has really pushed them to capture all of their other goals and succeed in other life areas.
I think it makes you feel good, and I'm
It does,
glad.
yeah.
Thank you. Well, you know what? I think we needed more time, but thank you both for the things you do, and keep it up.
Thank you.
In our final segment on Marion County today, we are going to talk about supported employment. And with me to talk about that are Katie Gonzalez from the Marion County Health Department and Lana Winnie. Welcome, ladies.
Thank you.
Thank you for being here. So Katie, we'll start with you. Tell us a little bit about yourself. How did you get involved in this role with Marion County?
So I'm Katie Gonzalez as the clinical supervisor. One of the programs that I have the opportunity to supervise is our supported employment program, which we call Work Solutions here at Marion County.
So what did you do before that?
I've worked at Marion County for about 3 years. I was an employment specialist on the team, and then later got promoted to the supervisor. I've worked in mental health field for about 4 years.
About 4 years? Where'd you go to school?
I got my undergraduate at University of Portland and my graduate up at Eastern Washington.
Very good. And
In
what did
social work.
In social work. Very
Yeah.
good. And Lana, tell us a little bit about you.
So I run adult outpatient behavioral health programs for Marion County Health Department. I've been with the department for about 2 years. Prior to that, I was running outpatient services in Washington County, and before that in Multnomah County. So I have quite a bit of experience with service provision for this particular population across the counties.
Excellent. So supported employment, let me just ask you, we're working on a video for breakfast that I'm working on, and one of the things that I was looking at were myths about mental health. And one of the myths that I read about is that people think that that those with a mental illness are unable to work. And then the real answer is, well, that's not true, because most people can actually work very well in jobs. So talk a little bit about that. What is the situation with the clients that you work with in Marion County in terms of their ability to be employed? And I'll start with you, Katie.
Yeah, so what the program believes is that anybody who wants to work has the ability to work. And so that's one of the really neat aspects about this program. It has zero exclusion. Really what we want is just that somebody's interested in working. The program really helps people.
So I'm not interested in talking about the program quite yet, okay?
Okay.
I really want to talk about the people that are involved in your program first. So there are some people that aren't involved in the supported employment program, right? And that
Correct.
just get a job
Yes.
without having supported employment.
Yes.
So what's the difference between the two? That's what I'm interested in.
Okay, I apologize.
No, it's okay.
So I think that the difference is, well, anybody can go find a job. It's just whether they want or need extra support. We're able to provide that with this program. But it's not that somebody can't get a job either way. It's just the statistics have shown it's more successful long term, and it helps people find jobs more that they're interested in. So rather than, shoot, I need to pay the bills, let me go find any job, it's more of, I've always wanted to do X, Y, or Z.
Okay, anything you want to add to that, Lana?
I would like to add that many of the individuals that we work with have a fear of work based on their ability to succeed, based on some of the challenges that they face, and sometimes just walking somebody through it and being there with them can help them be successful. To expand on what Katie was saying, that when people find employment that specifically speaks to their interests and preferences, then it turns more into a career and a purpose and a sense of productivity and contribution. And so the odds of them being successful sustainably greatly increases. And we also have a lot of individuals that are fearful of working because they're concerned that particular benefits or entitlements may be impacted by that. And supported employment helps individuals connect with those services that so they can know how benefits and entitlements will be impacted by working, and they can make some informed decisions around that. So there's a lot of different aspects I'm sure we'll get to.
Right, yeah, exactly. So, and I just want to kind of explore this more conceptually for our listeners, because I'm thinking that, or viewers, I guess it would be, that many of them probably have a lot of maybe stereotypes about what someone with mental illness is going through in terms of getting a job. So my sense is that there are people that manage their mental illness or in recovery, and they do it very, very well. And they're working beside us in different careers or jobs around this community, and we have no idea that they're managing a mental illness. So I think that the folks that you're working with may have a little bit higher needs, is that correct, and in the supported employment program?
I think that it goes back to what you were saying, though, that it could be somebody who you have no idea, because part of it is that you're getting people integrated into the community in competitive employment. So it's jobs that any of us could apply for, and that's really what we're assisting the individuals with. So we sometimes help find more specific jobs, but the vast majority of the individuals we serve are just building that relationship with the employers and working side by side with somebody without any kind of disability.
That's great. Yeah, there's a woman that I advocate for, and I know she got a job every year at the state fair. That was kind of her just annual job, and then is on disability. But then she got a job as a peer helper or a peer. I'm trying to think of what
Support
the title.
specialist.
Peer support specialist, right? And when she got that job, this is just triggered by what you said. She lost all of her food stamps, and her rent went up from her portion $50 a month, and she was making $80 a month being the peer support specialist. So, I mean, it really becomes kind of a question about I don't think our system is necessarily set up always to support people that have these high needs that are getting other services like you were talking about. So I don't think that's really uncommon, right? There are a lot of people that face those decisions that they have to make.
They face those decisions and challenges throughout, but that's one of the keys to having individualized benefits counseling, because competitive employment may look part-time and may not impact your benefits at all, or it may be a combination of maybe some benefits will be reduced while your wages offset that. So I think that it's really important that the benefits counseling piece of it is not generic. It's individualized and really specifically speaks to the individual and their situation.
Excellent. So that's one of the services that you provide with supported employment.
We actually connect the individuals with Work Incentive Network that does the benefits counseling. However, we are in the process of training individuals to be able to provide those counseling supports here within Marion County, within our department.
Excellent. So what other types of benefits do people get through a supported employment? Not monetary benefits,
Right.
but the...
So it's throughout the whole process. So anybody who's interested in employment should get referred. So it could be from identifying what kind of job somebody's interested in to writing a resume, visiting potential employers, to turning in the application. Once somebody gets a job, they're usually followed for about 1 year for follow-along supports. So that could be, what happens if you need reasonable accommodations with your employer, or, if there's any kind of interpersonal conflicts, how to handle that, reporting wages to Social Security, getting a promotion. People sometimes get part-time jobs and they want to work full-time, so being able to help support with those goals as well. So it really plays the whole way. So I like to say it's obtaining employment, but also maintaining that employment and really getting those dream jobs.
So about how many clients do you have in supported employment?
We have capacity of 80, and this, right now we have 37% working. Last month, I checked this morning, we had 8 job starts for the month of July, so we were doing pretty good. So it's really a great program that we have, and the employment specialists, we have 5, and they work really hard on really helping people find the jobs that they are interested in.
Do the specialists help with employers too if they have questions or needs?
Yep, so
support?
one of the requirements that they are out in the community every single week, meeting employers and building those relationships, answering questions, and just letting them know how great the program is.
So if there are employers out there listening, we'll put the contact information on afterwards, but I'm assuming you're interested in employers contacting you if they have jobs that they might
Definitely.
be able to provide.
Well, we have a steering committee, and that meets approximately 3 times a year. That includes potential employers, vocational rehab, peer support specialists, the peer support team, and members of the health department's executive team. And the purpose of that meeting is for us to provide information about where we're at, to get feedback about how we're doing, and to brainstorm about how to improve services and get more folks employed.
Well, thank you both very much for sharing information about the program. It sounds wonderful. Appreciate the work that you do.
Thank you.
Thank you.
And thank you for watching Marion County Today.